the lab prep for the heart and neck vessel. So the structure and function of the heart, it is a hollow, muscular, four-chambered organ. It extends from the left second intercostal space to the left fifth intercostal space, and from the right edge of the sternum to the left midclavicular line. It's an upside down triangle with the base at the top and the apex at the bottom. And in the anterior chest, we call it the precordium, and that is the anterior chest wall that covers that space of the heart. The heart valves, there are four of them in the heart, and they prevent backflow of the blood as it's processing through the heart. The atrioventricular valves are the entrance to the ventricles. These include the tricuspid valve and the mitral valve. The semilunar valves exit the ventricles, and this includes the pulmonic and the aortic valves. The cords tendineae anchor those valves and to the papillary muscle in the heart to help them close succinctly. The neck vessels that you will assess are your carotid arteries. Those are between the trachea and the sternocleidomastoid muscle. And your carotid artery pulse and your radial pulse should all coincide with the ventricular systole or the S1 or the lub sound. The jugular venous pulse or the pressure is there's internal jugular venous that's medial to the sternocleidomastoid, and the external jugular that's lateral to the sternocleidomastoid. So this returns blood to the heart from the brain. We look at jugular venous pressure and distension because that reflects the overall central venous pressure in the body. And when those veins are distended in the jugular, it can be connected to fluid overload or right-sided heart failure. Now, when you're assessing your patient for heart and neck vessels, we have them supine with the head of bed 30 degrees. You're going to inspect, auscultate, and palpate the heart and neck vessels. We want the environment to be warm. We want to have drapes available so we can provide privacy, because we'll be looking at the anterior chest or the precordium, and that's for women. We'll have breast tissue there, and so we want to only expose the areas that we're auscultating or inspecting. So when we inspect and palpate the jugular venous pulse, so we are assessing the patient, like we said, at supine 30 degrees, and we should not see that the distension in the jugular vein. If there's distension in any degree above 45 degrees and you have see that jugular vein, that can be fluid overload or considered distension. When we palpate those spaces, the carotid, we are palpating with our middle fingers. We're going to only do one side at a time, and we are assessing them from 0 to 3+. And this is just how easy that pulse is to obliterate, just like the other pulses in the body. The abnormal findings may be the pulses would be different strengths on one side versus the other. If somebody has an occlusion in that artery, that can be possible. So if you're thinking about sounds, the bruit might be in the vessels, but murmurs are found in the heart valve. So be able to understand what that those terminology mean. So for auscultation, you're going to begin by cleaning your stethoscope. Before you're touching the patient, you're going to provide instructions for the patient. They are going to be able to breathe normally. You really don't want them to take deep breaths because then you hear more of the breath sounds than you do the heart sounds. So breathing normally during this procedure is necessary. You're also going to give them the instruction about displacing breast tissue if you are assessing a woman because of where that mitral position is. So you're going to listen with the diaphragm first for all 5 areas that you see in the picture, and then you're going to listen with the bell that covers the entire precordium. You're listening for the lub-dub, lub-dub. The lub sound is Sicily, that's the S1, and the S2 or the dub sound is diastole. Now we hear the S1 best at the mitral position and the S2 loudest at the aortic or pulmonic positions. So when we listen with the bell, we're listening for extra heart sounds or incompetent valves or murmurs. So all the positions and the intercostal spaces are noted below. Aortic, second, right intercostal space. Right sternal border. Pulmonic, left intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid is fourth intercostal space, left sternal border. The mitral position is left fifth intercostal space, left mid-clavicular line. That is the clavicle midway between the suprasternal notch and the humerus, the head of the humerus. That is the mid-clavicular line.